Someone's going to find me out, they're going to ask me a question, I'm not going to know the answer to it. This was my job like 9 months ago and I was fine at it, but I can't do it anymore. Who's the registrar, which one's the SHO, which one's the consultant? The alarms are going to go off and I'm going to be called a fraud and marched out of the hospital. Do you have a nice sleep? My first on call in a brand new hospital, not knowing anybody or anything. I had a really horrible on call. I had this 53-year-old lady who had arrested. I was just so scared that I was expected to be in charge of all the cardiac arrests, and yet I felt totally unprepared. I do remember this sensation of not being able to hear. Like, I must have been so panicked, so nervous, so scared that I couldn't hear properly. I was quite distant from everyone else in the room, and then I'd be focusing on that and not focusing on what other people were saying. I remember feeling like I shouldn't be there, that I did not belong there anymore, that I might have been able to do that job once before, but I wasn't going to be able to do it again, never again.
What is imposter syndrome? It's the idea, really, it's our inner voice telling us that we're not good enough. It's a sort of nagging doubt that, why am I here? What am I doing? Do I really know what I'm doing? They call me a doctor, but I don't really feel like one.
I wasn't the med-reg, I wasn't who they were expecting me to be. I didn't have all this knowledge at my fingertips.
That critical inner voice reinforces, despite every element of evidence in front of you, that you're not good enough, that you can't achieve the task that's been set, and that you are an imposter in that role.
4 years ago, I left work to have my first baby, and I had 9 months of maternity leave at that time. It's now 4 years later and I'm off work after having my second baby, and I'm about to return in about 2 months' time. I think the thing that was missing the first time I went back to work was being welcomed. If people could have been a little more reassuring and just acknowledged that I was a person with a name, I would have felt a lot more safe and a lot more secure at that time. That was all completely missing from my first return to work.
Imposter syndrome can happen to anyone, but it can be particularly prevalent in doctors or medics or anybody in the health service because of the pressure and the expectations that people put on themselves, the expectations of those around them, their patients, but also their colleagues, their superiors and other professionals.
My training programme director sent me an email about a return to practice conference. They had like an A5 booklet that they handed out, and like half of one of the pages was about imposter syndrome, and I could have cried when I read that.
What do you do? It's actually being aware of its existence. So recognising it, naming it, talking about it.
I was so relieved that it wasn't just me, that it was a thing, and that I was in a room of people who were also going through the same things for whatever reason.
And I think it's that openness to the fact that it exists. It makes it less frightening, it makes it more accessible. It's a thing, but we can change it.
There was a trainee from Cardiff. She was on maternity leave, and actually she didn't want to go back to work, and there was just a group of us talking to her about going back to work and how you can make things work for you and how not to give up your career that you've worked so hard for and actually maybe go back and give it a go.
And being brave enough to break that cycle and reduce the stigma of anything like imposter syndrome or other mental health issues is really important.
I'm really keen on people not, things changing and people having support if they need it. I get that not everyone needs support when they return to work and they can just breeze on through, but that wasn't the story for me. So I do want to help other people that are in that position.